Hello everyone, my name is Jacqueline Hoffman-Gibbs, and today I'll be giving a presentation on community assessment in Queens County, New York. I chose to conduct the assessment in Queens County because I currently reside in New York City, and the city that I'm in is actually in Queens County. So I wanted to learn more about the health of our community and the kind of assets and resources that we have available for the residents of Queens. The objectives of a community assessment is to find out what areas are strongest and the weaknesses, to find out how it affects the community and what kind of issues the citizens are currently experiencing. We also try to figure out the kind of resources that the county has so we can create interventions and programs that can assist with the health issues and hopefully alleviate the problems that the residents are experiencing. Queens County is an urban area and it has more than 2.3 million residents. It's quite large. Amongst the residents, there are 28% that are Hispanics and 25% are white, 25% are Asians, and so on and so forth. The majority of the population is from ranges 35 to 54 years old, and the income in the county is actually less than per capita in the United States. Now, keep in mind that the cost of living in Queens is much higher than majority of the areas in the United States. So therefore, poverty level is a big issue, and cost of living along with the housing in the area. In Queens, there are only 31% of residents that actually earn a bachelor degree or higher, which is not that much. So if you think about it, the health of an individual is typically affected by their education, so therefore only having 31% of residents with at least a 4-year degree really affects how their health is. The health issues that we see in the county are pretty typical compared to the areas around, with the 5 boroughs in New York City, along with Nassau County, which is also Long Island. It's also pretty similar to the ones we're experiencing in the United States. The number one cause of death is heart disease, and second is cancer. Third is influenza and pneumonia. Now, 34% of the deaths in Queens County are due to heart disease. Now, we see this all across the country, and we know that there are some factors that affect heart disease. These include poor diet, lack of exercise, and of course, tobacco smoking. The methods that we used in gathering information for this assessment is the MAP-IT framework. We use it to analyze the problems in Queens so we can create interventions so we can address these issues. MAP-IT stands for mobilize, assess, plan, implement, and track. We also conducted windshield surveys so we could see different parts of the county, and we can see what kind of resources that the residents have that are visible to the naked eye, aside from having to look up the kind of resources that we actually do offer. Some things that you will see include obviously the churches and senior citizen centers, Planned Parenthood, and obviously the medical facilities. We also conducted community leader interviews. We conducted two interviews with health leaders and two interviews with religious leaders. I selected to have two of each because Queens County is so huge, and I wanted to get the perspective of individuals from different areas of the county. So I interviewed a doctor, a nurse, and two pastors from churches, one in the northeast corner and one in the southwest corner. The assets and resources and capabilities that we found in Queens are actually quite extensive. There are approximately 7,100 places of worships in New York City. I know that's a lot. That includes 2,000 churches, 4,000 informal places, used for religious gatherings, 1,000 synagogues, and 100 mosques. Excuse me. There are 110 universities and colleges which offers a variety of area of study. I know New York City is known for offering some of the best education in the country, so there are a lot of students that come in the city to obtain their education. We have some of the top cancer research facilities in the country. One of them is actually Sloan Kettering Cancer Research Center, which is actually located in Manhattan. But since it's a part of New York City, I added it as one of the resources for this assessment. There are immigration services, elderly assistance, and substance abuse centers located all throughout the county. There are also numerous mental health facilities. There are 4 dental facilities, 3 vision facilities, 20 health centers, and 2 large hospitals. There are also 3 adult day health services, 1 home health facility, 8 nursing homes, and 11 substance abuse centers. There are also 42 wellness and prevention services and 24 mental health facilities. They also offer assistance for insurance registration, financial assistance, and numerous social services all throughout the county. For the issues that we have found, I wanted to focus on heart disease, since as we previously mentioned, more than 30% of all deaths in Queens County are due to heart disease. Now, we examined these issues and came up with the following recommendations. Educating the residents on the available resources in the county. From the previous research, it was identified that there is quite extensive resources. However, many of the residents are not aware of them. There are outreaches for preventative measures and social services and all types of assistance. However, some of the requirements can be quite extensive, so therefore the residents are not actually trying to actively seek out assistance. Now, I think it's important to advertise these to the residents of Queens County. They can utilize social media and public transportation, since, as many of you know, public transportation such as the subway system is a large way to get around here in New York City. I also think it's important to educate the residents on preventative measures, such as the reduction of tobacco smoking and how it can affect the risk factors for heart disease, healthier diet, and exercise. For my paper, I actually suggested to use the bike lanes that are starting to appear in Queens County, along with providing assistance to farmers market. Farmers market here in Queens County are found pretty much in all areas of the city and different parts of the county. However, some of these farmers market are going out of business because they don't have enough assistance from the county, along with not having enough advertisements, because many residents don't really even know that the farmers markets are healthier options for them and also cheaper. So providing assistance from a county-based perspective to make sure that farmers markets stay in business so they can provide healthier options to their residents can help alleviate some of the risk factors for heart disease and hopefully reduce the number of high cholesterol and high blood pressures from the residents in the county. I also suggested to have a central access to these resources. Now, we previously mentioned that there is a lot of resources in Queens County, but many people are not aware of where to obtain these services and how they can get to them. I suggested to create a mobile app that is available in all languages, since Queens County is so diversified that every language around the globe can be found in Queens County. So having a mobile app that will allow residents to access these services can help to obtain these resources for the residents. Disease management is also important for those that are already diagnosed with heart disease. We can provide support groups and healthcare facilities to help families and the individuals that have been affected by heart disease. By doing so, we can hopefully alleviate the risk factors that involves the genetic conditions that can affect the prevalence of heart disease as well. Thank you so much for watching my presentation.